Very much, Madam Deputy Speaker. With permission, I'd like to update the House on COVID-19 and our vaccination programme. Earlier this summer, we took the fourth step on our roadmap. We were able to take this step, Madam Deputy Speaker, because of our vaccines and the way that they are working. The latest data from Public Health England estimates that our jabs have prevented over 100,000 deaths, over 143,000 hospitalisations and around 24 million infections. Across the United Kingdom, we have administered over 91 million vaccines. 88.8% of people over 16 have had their first dose, and 79.8% have had their second dose. Our jabs are building a vast wall of defence for the British people. But, Madam Deputy Speaker, this vital work is not yet complete. With the Delta variant sweeping around the world, we have seen how it thrives on pockets of unvaccinated people. Last week, across the UK, we saw an average of 34,000 new cases and 938 hospitalisations each day. So it is vital that we continue to plug the gaps in our defences and widen and deepen our wall of defence. Over the summer, we have continued to do that in several ways. In August, the JCVI recommended that vaccines should be offered to 16 and 17-year-olds. They also recommended jabs for 12 to 15-year-olds with specific underlying health conditions and household contacts of someone who is immunosuppressed. We accepted both recommendations, bringing us into line with countries like Sweden. In recent weeks, 16 and 17-year-olds have been coming out to do their bit in droves, travelling with schoolmates and family members to get the jab. And we are taking the jab to people too, with walk-in and pop-up vaccination sites at football stadia and shopping centres and, of course, university freshers' fairs. I think we got to 20 universities. Over the bank holiday weekend, NHS pop-up sites at Leeds and Reading festivals made picking up a jab as easy as getting a beer or a burger. As a result of these kinds of efforts, more than half of 16 and 17-year-olds across the United Kingdom have received their jabs since becoming eligible last month. And this is in addition to over 3 in 4 18 to 34-year-olds, 76.3% of 18 to 34-year-olds who have already had at least their first dose. So much of young people's enthusiasm, Madam Deputy Speaker, I believe, comes from the fact that they've seen firsthand the chaos COVID-19 can bring. They have sacrificed so much and shown that age is no barrier to public spirit. I'm sure the whole House will join me in thanking them for playing their part in helping us all live safely. Madam Deputy Speaker, on Friday, the JCVI outlined their recommendations on the vaccination of children aged 12 to 15 years who do not have underlying health conditions. They concluded that whilst there are benefits to vaccinating this cohort, taken purely on health terms, that benefit is finely balanced. Building on the JCVI's advice, we will now consider advice from the UK's 4 chief medical officers and make a decision shortly. We have already accepted the JCVI's recommendation that 12 to 15-year-olds with the following conditions become eligible: hematological malignancy, sickle cell disease, type 1 diabetes and congenital heart disease, and those with poorly controlled asthma. And this will amount to an extra 200,000 teens becoming eligible. Madam Deputy Speaker, I also want to take this opportunity to address vaccination in pregnant women. Both the Royal College of Obstetricians and Gynecologists and the Royal College of Midwives have both recommended vaccination as one of the best defences for pregnant women against severe COVID infection. Extensive real-world data show our vaccines are safe and highly effective for pregnant women. We now know that pregnant women are more likely to become seriously ill from COVID if they are not vaccinated. In fact, Madam Deputy Speaker, 98% of pregnant women in hospital due to COVID-19 are unvaccinated. Yet we also know that not one single pregnant woman with 2 jabs has required hospitalisation with Covid-19. So I urge pregnant women to continue to come forward and get the jab. And our new PregCov trial is advancing knowledge on how we can even better protect pregnant women and their babies. Taking all of this together, Madam Deputy Speaker, our overreaching ambition is to widen our wall of defence so we can protect more and more people. As well as widening that wall of defence, we are deepening it. Last Wednesday, the 1st of September, the JCVI advised that people with severely weakened immune systems should have a 3rd vaccine dose as part of their primary COVID-19 vaccination schedule. It will be offered to people over 12 who were severely immunosuppressed at the time of their 1st or 2nd dose, such as those with leukemia, advanced HIV and recent organ transplants. This, I must stress, Madam Deputy Speaker, is separate from any potential booster programme for the rest of the population, and the JCVI is still investigating who should receive boosters. Our COV Boost study is comparing immune responses produced by 3rd doses of different brands of vaccines. It's a statement.
It's a statement, so you can Bob if you need to.
And as ever, whatever the clinical decision from the JCVI, the NHS will be ready. We will proceed with the same sense of urgency we have had at every point in this campaign. Madam Deputy Speaker, vaccines remain our most important line of defence, yet they are not our only line of defence. Regular testing continues to play a crucial part in returning this country to something that feels a bit more like normal. And PCR tests remain freely and easily available. Anybody with symptoms should make sure to get tested. Children are returning to classrooms across these islands, and I'm sure all honourable members welcome that, as did the Secretary of State for Education at Questions this morning, and they return to an immeasurably better setup. No more homeschooling, no more bubbles, teachers vaccinated, all 16, 17-year-olds offered a 1st dose before returning. It matters because we know that face-to-face education is the best place for children and young people, and rapid testing can uncover hidden cases of the virus at the start of term. Whether it is our constituents or our children, we must encourage people to do it. On their return to school and colleges, students should take 2 rapid tests on site, 3 to 5 days apart. They should then continue to test twice weekly at home. And to university students, I would also say this: make every effort to get fully vaccinated before going back. It has never been easier to drop in and get your vaccine and get the necessary testing too. These are straightforward steps, but they are essential in stopping the spread. Finally, Madam Deputy Speaker, I'm sure the whole House will join me in welcoming the additional £5.4 billion cash injection we're putting into the NHS. This investment will go straight to the front line, supporting our COVID-19 response over the next 6 months. The funds include £1 billion to help deliver routine surgery and treatments for patients and tackle our backlog. These funds take the government's total support for health services in response to COVID-19 to over £34 billion this year alone. Madam Deputy Speaker, we are widening and deepening our wall of defence. We're getting jabs to more people and getting some people more jabs, and we are getting the NHS what it needs. The ask of our NHS colleagues continues to be complex and challenging, and yet they rise to it day in, day out. I pay tribute to everyone involved in these life-saving efforts. We must keep going, and I commend the statement to the House.